Most people believe dementia begins the moment their loved one starts forgetting names or getting lost. But in neurology, we know something very different. Dementia begins 10 to 30 years before the first noticeable symptoms. That's what research shows. Long before memory slips, the brain is already undergoing structural and biochemical changes. Changes we can now measure on MRI, PET scans, and even emerging blood biomarkers. So when your loved one starts showing new personality shifts, new judgment issues, new difficulty planning tasks, they aren't being stubborn and they aren't getting just older. These are neurological changes unfolding beneath the surface. So today, I'm going to break down what dementia actually is and what it's not, and why understanding the difference changes everything for caregivers. So a while back, I evaluated a woman named Linda, a retired teacher, a mother, someone who took pride in being organized her entire life. Her daughter didn't bring her in for memory problems necessarily. She actually brought her in because Linda suddenly couldn't follow a recipe she had made for 20 years. She became unusually impatient, and she was getting lost in conversations in a way that didn't match who she had always been. Her family wondered if she was stressed, tired, or simply aging. But when we looked closer, her cognitive testing showed weakness in executive function, not memory. Her MRI of the brain showed early small vessel ischemic changes, and her clinical pattern fit what modern research has made very clear. Dementia almost never starts with memory loss. It starts with subtle changes in planning, judgment, attention, behavior, and the ability to process information. This is because dementia is not a moment, it's a decades-long brain disease. According to the Alzheimer's Association and in multiple Lancet Commission reports, the pathological changes of Alzheimer's and other dementias begin 10 to 30 years before symptoms. During that time, the brain undergoes shrinkage, protein accumulation, vascular changes, and disruptions in communication between neurons. So Linda wasn't declining suddenly. Her brain had been changing for years until the symptoms finally surfaced. And that is exactly why caregivers need clarity, not confusion. Dementia is not a single disease. It is a syndrome, a collection of symptoms that appear when the brain is losing cognitive abilities faster than expected for age. To clinically diagnose dementia, we look for a decline from previous baseline deficits in one or more cognitive domains, such as memory, language, attention, judgment, executive function, and visual spatial skills. What is the interference with daily independence? This is what separates dementia from normal aging. Let's talk about types of dementia. Alzheimer's disease. This is the most common out there. It begins with difficulty forming new memories. Then you have vascular dementia from a stroke or chronic microvascular changes in the brain. Vascular dementia might begin with slow thinking or planning issues. Now you have Lewy body dementia that presents with fluctuations, visual hallucinations, stiffness, and medication sensitivity. You have frontotemporal dementia, which it's more like personality changes, behavior, or language changes early on. You have mixed dementia, which is very common now, and it's often a combination of Alzheimer's plus vascular dementia. So dementia is a neurological disease, not a behavioral choice. Also, dementia is not normal aging. Normal aging includes occasional forgetfulness, but dementia impacts daily life. It's not just memory loss. Early signs often involve planning, judgment, or behavior. It's not supposed to be sudden. Sudden confusion usually indicates delirium, which can be reversible. Dementia is not just caused by one factor, it is multifactorial. There's genetics, vascular health, inflammation, lifestyle, and protein accumulations. Now, we can slow progression, manage symptoms, and drastically improve quality of life. What are some early signs that you should not ignore? Repeating questions or stories, getting lost in familiar places, difficulty following steps, new poor judgment, personality changes, language issues, misplacing items in unusual places, losing track of time or sequence. So when these appear together and progress, we start thinking about dementia. Here's some common misinterpretations. Oh, they're doing this on purpose. No. The frontal lobe controls reasoning, impulse regulation, and dementia affects this early. Well, they look physically fine. Why is their behavior changing? Because dementia impacts cognition before mobility. Oh, but they remember childhood. How come they not remember breakfast? Well, long-term memory is stored differently and remains intact longer. Well, they had a good day. Maybe they're okay. Fluctuation is common, especially in Lewy body in vascular dementia. Now let's talk about how dementia is diagnosed. So the diagnosis is going to require cognitive tests. In clinic, we use something called MoCA, which is the Montreal Cognitive Assessment. We also use something called a mini mental status exam, a detailed history, a functional assessment. We usually order some labs, such as thyroid, B12, comprehensive panels. We also order MRI of the brain or a CT scan. But just know that a CT scan alone or a short conversation is not enough to diagnose anyone with dementia. So, what can caregivers do? You can positively influence quality of life through routine and structure, simplifying tasks, reducing overstimulation, supporting sleep and hydration, validating, not arguing, by taking meaningful activities, ensuring safety, early taking care of yourself as well, because if you are the caregiver, you're going to need some help and support as well. So your role is powerful and transformative. So to recap, dementia is not just memory loss. It is a long, gradual neurological process that families deserve to understand. And when caregivers have clarity instead of fear, the entire journey changes. Now, before we close, I want to personally invite you into a personal space I created for anyone on a journey of growth, healing, and learning. It is the Rosabel community. It is completely free to join, and inside you'll find a wide range of resources, caregiver guides, wellness tools, mindset support, and educational materials I created for this community. And when you join, you will also get access to our private Facebook group. This is a supportive space where people can ask questions, share experiences, and connect with others who are working through their own personal and caregiving journeys. You can join anytime and download all your free resources at rosabelzohfeld.com/rosabelievers. So if you've been wanting community, clarity, or meaningful support, this is where you'll find it. Don't forget to subscribe, give a like, make a comment. Take care.